Well, good afternoon, everyone. I'm here with the Illinois Department of Public Health Director, Dr. Ngazi Ezekiel, to provide an update on Illinois' progress vaccinating the public, as well as to report two important and major announcements about vaccine eligibility and about our gradual path back toward normalcy, even as we continue our broader battle against COVID-19 to protect our residents, to save lives, and of course, to bring this pandemic to an end. Illinois, we have come a long way since the first doses of vaccine were administered in our state on December 15th, and since vaccine supplies really began to ramp up at the beginning of February. As of this morning, over 4.3 million doses have been administered in our state. More than 1 in 4 Illinois adults have been vaccinated, including 58% of our seniors 65 and over. We've established over 900 vaccination locations, launched community outreach initiatives, partnered with federally qualified health centers, safety net hospitals, and critical access hospitals to reach underserved communities, and we've set up one-stop rural clinics with Johnson & Johnson vaccine. Illinois is a leader among the largest population states in getting first doses into arms. So let's be clear. Much of our success is due to the strength and stamina of our healthcare heroes and members of the Illinois National Guard across the state who are safely and quickly administering doses to our residents. They're managing throughput at our mass vaccination sites, and they're helping people schedule appointments. More and more people are able to get vaccinated because we have the personnel who are making it happen. Of course, none of this would be possible without increases in vaccine supply. Since it's their first days in office, the Biden administration has nearly doubled weekly vaccine distribution to states, from 8.6 million to over 16 million doses this week. Deliveries continue to rise and are expected to increase by millions more this spring. With the increased supply, Illinois is now averaging 100,000 vaccinations a day. That's about 1% of all adults in Illinois getting a shot each day, and I expect that number to continue to grow in the weeks ahead. To give you some sense of the supply trajectory, back in December, the first weekly shipment that arrived into Illinois was about 109,000 doses. Again, weekly shipment. This week, more than 800,000 doses were delivered to Illinois. Based on current projections, we expect that that number will surpass 1 million doses in April. The Biden administration has met or exceeded all of its vaccine projections to date, and I have every confidence that they will continue to do so. That's why I'm pleased to announce that I'm directing every jurisdiction that receives allotments of vaccine through the state of Illinois to expand eligibility to all residents 16 and older on Monday, April 12th. That includes local health departments, state-supported mass vaccination sites, pharmacy partners, and other providers. Additionally, to ensure our more vulnerable residents are prioritized, Dr. Ezekiel and I will be announcing additional populations who will be made eligible for vaccination prior to April 12th in the days and weeks ahead. Our vaccination infrastructure will continue to grow beyond the more than 900 locations that are available today, and even more National Guard troops will be deployed to assist in administering those doses. Additionally, we're working with local health departments to expand the use of special days reserved for our most vulnerable populations, like our seniors. That said, even with all the progress of vaccinating more than a quarter of our adult population and almost 60% of our seniors, and even with the massively increased supply of vaccine, there will still be a need for patience. We have visibility into vaccine supplies approximately 3 weeks ahead of their arrival. That allows an increasing availability of appointment times. But if everyone tried to get vaccinated on the same day, it just couldn't be done. Nevertheless, by mid-April, we will be at a point where dividing up the population into phases won't make sense with the ever-increasing supplies that we expect to see. President Biden set the bar for opening eligibility to all adults nationally on May 1st, and his administration has been quick and decisive to allow Illinois, for example, to hurdle that bar 2.5 weeks earlier on April 12th. It's truly amazing to be at this point in our pandemic response if you think back just a few months ago. On this day 1 year ago, my administration launched our COVID-19 response website, coronavirus.illinois.gov, to provide information about the virus that has transformed life as we know it. Today, that website functions as a life-saving vaccine finder, guiding our residents to the local vaccination locations closest to home. Vaccination sites are continually added to our vaccine finder, so it's worth checking back if you couldn't find an appointment the first time. A second major announcement today is an update to our public health mitigations. As a reminder, because of the steps that Illinois took, our state never ran out of hospital beds or ventilators or doctors to care for patients, even when other states did. So if you were a car accident victim or experiencing a heart attack or in need of cancer treatment or a mother in labor or sick with COVID and gasping for air, there was always a hospital available to treat you, even in the worst moments of this virus's transmission. I want to thank the people of Illinois for their incredible efforts at prevention. Your diligence has kept your friends and your family safer and your community healthier. And we owe an enormous debt of thanks to our doctors and nurses and healthcare professionals who have been on the front lines risking their lives to save ours, fighting a war against COVID-19 inside our hospitals that few outside really have yet to see. Heroes all. Unfortunately, COVID-19 has not gone away. Each day, people in Illinois and across the nation are getting sick and being admitted to the hospital with this deadly virus, and people are still passing away from it. But the light that we can see at the end of the tunnel is getting brighter and brighter as more people get vaccinated. And I'm more optimistic today than I have been at any time over the last year. And more importantly, the doctors and scientists are too. It's time to begin to cautiously move toward normalcy. And it's imperative that we do so in a way that maintains all the progress that we've made to date. As we've seen, there's more to a strong economy than just ending capacity restrictions. People have to be safe, and they have to feel safe too. That's why moving forward, Illinois will advance towards normalcy with a dial-like approach, allowing us to dial it up as things are improving. Over the year, we have progressed from phase 1 to phase 4, and we're on the verge of the ever-elusive phase 5. Our progress toward phase 5, like all the decisions that we've made, will be based upon the data. The first move forward will be into the bridge phase, a transition period with higher capacity limits for businesses and gatherings. This will allow Illinois to restore normal operations faster without ignoring the risks attendant with the new variants that we see rising around us. As with all of our decisions, Illinois' move into our bridge phase and then into phase 5 will be based on metrics recommended by doctors. Barring any significant reversals in our COVID-19 hospitalizations and deaths and cases, Illinois will move into this bridge phase when 70% of our 65 and older population receives at least one dose of the vaccine. I'm optimistic about reaching that milestone because as of this morning, that number is 58%. Our seniors have tragically borne the brunt of this virus's consequences, and we must continue to take action to keep them all safe. The widespread vaccination of seniors as a group marks tremendous progress at overcoming this pandemic. Our next step into phase 5 measures a decrease in burden on the rest of our population. So after a 28-day monitoring period in the bridge phase, and assuming no significant resurgence of COVID-19 cases, hospitalizations, and deaths, Illinois will resume normal business operations when at least 50% of our 16 and over population has received at least one dose. As of this morning, that number is 28%. Even at that point, there is a significant risk to the population of those who may not yet be vaccinated. So I also want to address the requirement to wear a mask, which has been in place in Illinois since May 1st. In short, we are able to make these significant moves forward toward normalcy because people will continue to be required to wear masks in public when they can't maintain proper social distancing. So Illinois will lift its face covering requirement when the CDC recommends it. Masks have been one of our best ways to reduce risk in this pandemic, and we won't be foolish at throwing away our best weapon heading into the last lap of this fight. Folks, this is an exciting day. Although we still are in the midst of a global pandemic, the end seems truly to be in sight. And while we're racing against a tough clock, the new, more dangerous variants, that is, it is fully in our power to turn the page on this dark and devastating chapter. These vaccines are our fastest ticket back to hugging our grandkids, eating inside restaurants without worrying about the risks, school dances, community celebrations, all the things that we miss about normal life. So don't let up. Join me in wearing your mask and getting vaccinated when it's your turn. Step by step, we can get out of this the same way we came into it, and that's together. So thank you, and with that, I'd like to turn it over to Dr. Ngazi Ezekiel. Doctor?
So yes, good morning and happy Thursday, and I think we have lots of reasons to be happy. And we have a lot of good news that you've just heard. We are seeing the number of people vaccinated increase every day, and all signs are pointing in the right direction for moving towards getting back to doing more of the things we love in the ways that we love to do them. Our daily case rate has dropped from an all-time high in November of 95 cases for every 100,000 people in Illinois to now just 12 cases per 100,000 people. Also in November, we saw an overwhelming 6,100 people in the hospital with COVID. And now we're currently seeing between 1,100, 1,150 people in the hospital each day with COVID. This is the lowest we've seen since we started tracking these numbers. Our daily mortality rate has also dropped. It's down to 2 individuals for every 1 million people in the population. Combining these decreasing trends in cases and hospitalizations and deaths with increasing vaccinations, that is clearly a recipe for ending this pandemic. We cannot lose our momentum. To do this, we will continue to wear our masks. We absolutely will not have any mask burning parties. We in Illinois know the importance of masks. We know that we still need to avoid crowds as possible and keep our distance. Vaccination will also keep our momentum continually going forward, and we've seen a tremendous response from people all across the state wanting to be vaccinated. I am so proud of the people of Illinois. They know how important this precious life-saving resource is, what it means for us as individuals, for our families, and for our communities. And so that's why the demand for the vaccine is greater than the supply, but that's for now. And as the governor has shared, we believe the predictions from the administration that the supply will ramp up and that we will be able to provide this vaccine to everyone. If you are eligible now and haven't been able to make an appointment, continue to try. As the amount of vaccine increases, more appointments will open up. Last week, IDPH launched the Vaccine Appointment Call Center, and that's to assist people who may not be able to make appointments online. Call agents will help individuals who do have access to online services but need help navigating the various registration sites. Also, if the individual doesn't have access to online services or can't navigate the site, the agent will make appointments on these individuals' behalf. That vaccine appointment call center number is 833-621-1284. Again, 833-621-1284. The increasing vaccination rates are how we will move forward, and they are how we will get closer and closer to that herd immunity. And also, like the governor said, certain proportions of our residents will need to be vaccinated so that we can move into this bridge phase and then finally onto phase 5, which is functionally our return to normal. So we will continue to monitor the amount of virus circulating in the state. We will continue to monitor the burden of COVID-19 on our healthcare system. Hospitals will need to have a 7-day average of at least 20% of ICU beds available. And if metrics show no sustained increase in the mortality rate, if there's no increase in the COVID-like hospital admissions or the number of people in the hospital with COVID, if we monitor that over a 28-day period or 2 incubation periods, the state will move forward. All 3 COVID-19 vaccines currently authorized for use in the United States are effective in preventing hospitalization and death. The more people vaccinated, the fewer deaths we will see and the less chance we have of overwhelming our hospitals. And while vaccination is key to getting back to some semblance of normal, we must continue to implement the public health measures. People who've been vaccinated should continue to follow CDC's recommendations on how to interact with others, as well as people who've been vaccinated and people who haven't been. That does mean for the time being wearing a mask, but as the CDC has indicated, if you have individuals in a private setting, in a home setting, who've all been vaccinated, you can loosen those personal mitigations. Again, wearing the mask is not going to be forever, but until more people are vaccinated, this will be the path forward. Testing is also vital. I know we're focusing so much on vaccination, but we can't forget the importance of testing. Illinois continues to have some of the most accessible COVID-19 testing in the country. Knowing if someone does have COVID-19 and knowing that quickly helps the contact tracers identify close contacts, slow the spread, and stop future potential surges. We have come so far, Illinois, and we have to go just a little bit further. Maybe we're in the 25th mile of this marathon, but we will stay motivated and we will keep going because the finish line is absolutely in sight. Thank you, all of the people of Illinois, for helping us to get to this point.